physician, and my company name is Budding Potentials. And for the last three and a half years, we've been driving all over the state of Maine, helping to evaluate those who would qualify for medical marijuana. We understand more and more about some of the differences that we're coming face to face with, especially right now. What do we do with recreational and medicinal? Is there a difference? How can we identify that difference very clearly? We can talk about first, the simple thing, THC. It's psychogenic. It makes the euphoria. For some people, it makes paranoia. For some people, it helps put them to sleep. But it is the part of recreational that is the selling aspect of the plant. In fact, those plants can be bred through genetics to be so high in THC, there's very little other components left in the product. Its purpose is psychogenic activity. Medicinal, I could not go to work on THC all day, but certainly if I had Crohn's, if I had cancer, if I had tremendous arthritic pain and nerve pain, if I had a wasting syndrome where I could not eat, I would be treated as a medicinal patient, not as a recreational citizen. My marijuana would be very low in THC and much more loaded with the other cannabinoids essential to treatment of the physical.
Cannabis does not have to be something that gets you high. There are so many strains and varietals of cannabis available that have different ratios of cannabinoids, which are the active compounds in the cannabis plant. Most of the cannabinoids in cannabis are non-psychotropic. It's only delta-9 THC in essence that gets you high. You can have a completely non-psychotropic formulation for a patient, so they need not fear the getting high aspect. We have ways around that.
There are some of those CBDs known to target tumors, to decrease the size of tumors. Prostate cancers have shown that there's an effect on the cancerous cells with CBDs.
If the potential of cannabis therapy could be more widespread, if there could be more public education on it, if medical caregivers, there are forces out there that would like the public at large to believe that we're a bunch of blacklist drug dealers. I mean, if they could really be educated about what cannabis can really do, I think we could have a lot of people completely skip the cookie cutter cancer protocols and use cannabis oil either alone or in concert with maybe some of the allopathic options that are out there, and we'd have a lot less death. Cannabis research is growing by leaps and bounds. A friend of mine, Dr. Michelle Ross out in Colorado, she is the founder of the Impact Network, and she does amazing research out in Colorado, and she's actually gotten government grants to study the effects of cannabis. And in what we find in 1 year or 2 years, where I couldn't have imagined 2 years ago what we know now. If we're allowed to continue this research, I think it's going to be amazing to the point where in 100 years, people are going to look back at us and say, man, those people were idiots with all those pharma drugs and all those crazy, you're zapping themselves with chemo and destroying their organs when they could have used a plant. I think it's evolving at that rate. And so that's why now with addiction just wiping out entire segments of our population, I'm very inspired to keep going.